Let's get to health. And this morning we have a very interesting discussion up ahead. We have Dr. Kuti OIakunle. He is a medical director for non-governmental organization, Fruitful Vine. He is a general practitioner with keen interest in public health and well-being and is actively involved in management of COVID-19 patients. Today on the show, however, he will be talking to us about prostate cancer. So let's already go ahead and say hello, good morning to you, Dr. Kuti. Can you hear me?
Hello.
All
Hello,
right.
Good morning. I can hear you.
Fantastic. Good to have you here.
Same here.
All right. So last week we talked about colon cancer. Of course, Chadwick Boseman passed away. But this week we're focusing on a different kind of cancer, and that's prostate cancer. First off, before we go ahead, I'd like you to please explain cancer and then prostate cancer so we get a good foundation to go.
Okay, so cancer basically, they're just abnormal cell growth. So we have cells in the body and we expect them to grow normally. But when those cells grow haywire, they grow abnormally. And prostate is this organ that is found only in males. It's just below the bladder. It's an organ that is responsible for secreting some fluid inside the male semen. So when that organ, the cells in that organ, when they grow abnormally, then we have what we call prostate cancer.
Okay, so normally doctors have it difficult explaining why cancers exist in any case. But is it okay to ask what exactly causes prostate cancer?
Well, like you said, it's usually very difficult sometimes to pinpoint why exactly this is happening. But for prostate cancer, there are genetic mutations. So the cells have what we call genes. These are they are like proteins that code what the cell do. And there are, in some cases, these genes are not coding the right thing they're supposed to do. So they go haywire. They're not what they're supposed to do. They're not doing what they're supposed to do. They're doing another thing. The reason why that is nobody knows. Like, it happens spontaneously, but there are risk factors that have been associated with such mutations. The risk factors are like old age. It has been found that the older you get, the more the genes go haywire. Obesity, when you eat much of fatty foods as well as low fiber diet. Then also, for one reason or the other, the black population has been associated with such mutations.
Oh, really? We stand more risk of having prostate cancer as Africans? Is that what you're saying?
Yes, Africans have more risk of having prostate cancer than the Europeans.
Okay, so let's take a look at that name, prostate cancer. Prostate itself, what is prostate? Because I would associate it with a part of the body, but what exact part of the body is that? What organ?
Okay, it's just an organ, the small organ just located below the bladder.
Okay.
And it's also in front of the rectum.
Okay.
So the function basically is just to secrete some fluid inside the semen of males. So when you ejaculate, what makes the semen watery or fluid is prostate that's secreted.
Okay. So what are the symptoms for prostate cancer? What should one be looking at if they suspect that they might have it already? And when is it time to go see a doctor?
Okay. The time to go see a doctor, number one, if you have a risk factor for it, like if you have a family history, maybe someone, your brother, your father, your uncle has already had prostate cancer in the past, you are usually advised from 45 years and above to regularly go for screening. However, if you don't have those risk factors, symptoms that usually present with, unfortunately, in the early stages of prostate cancer, it's usually asymptomatic. It doesn't present with anything. So by the time symptoms are already coming, it's usually advanced. And things are seen as weight loss, there is pain while ejaculating or while urinating, there is blood while urinating, and sometimes you can have this back pain or pelvic pain. That's when the tumor has metastasized, has moved to other parts of the body. So basically, those are the few symptoms that you see. But majority of the time, people that have it early, usually asymptomatic. So when you pick it, usually maybe an incidental finding. The person just went to the hospital, they did an examination, and they found out. Typically does not have symptoms in the early stage.
Okay, so risk factors, being African is one of them, and then being advanced in age is another one. And you said something very worrying, which is the fact that by the time symptoms are actually manifesting or that they're visible, it's already too late. Is that what you said?
Yeah, by the time symptoms are manifesting, yes, it's most likely that advanced.
So would this mean that it is best in our interest to actually have checkups to check whether or not, even if we don't see any symptoms? Is that a wise advice for, well, African men especially?
Yes, it is. After the age of 45, you are usually advised. You can do the simple blood test. It's called the PSA. So when you do that, the PSA is like a substance in the blood that measures if something like that is happening in the prostate. So you can just go to the hospital, they do your PSA, and you can know. So if the PSA is rising, then it's suggestive that something is going wrong. And
is this test expensive? Because we know how we feel about spending money, especially for checkups here. Our culture is not exactly that kind. How expensive is such a test?
Nah, the PSA is not expensive. It's less than 3,000.
Okay.
Less than 5,000.
Okay. Now, a bit of confusion here with a couple of the terms used when it comes to doctors who attend to people with prostate cancer. And a urologist and an oncologist, these two individuals are people that we will meet or might meet if we happen to have this ailment. What are their basic or what are their definite functions, these kinds of doctors?
Okay, so the urologist is the person that treats anything that involves, is a surgeon that treats anything that involves the kidney down to the urethra. He's involved in treating prostate cancer and all that. While the oncologist is the ones that they are involved in treating cancer cells. So urologist does not necessarily need to treat cancer cells. But oncologists treat cancer cells. So both of them are usually very useful in the management of prostate cancer.
All right.
Because if you have to reset, if you have to remove the tumor, the urologist is the one that removes the tumor, while the oncologist is the one that gives the chemotherapy, the radiotherapy, the hormonal therapy, because it's a combined treatment, depending on the state. So in some people, you have to remove the tumor from the prostate.
Are there any side effects to these treatments? Are there any side effects?
Yes, for the chemotherapy and the radiotherapy, there are side effects. Things like hair loss, things like weakness, fatigue, and so on. But they are not side effects that you can't handle. There are side effects that can be handled, but yeah, there are side effects.
You've already told us who is most at risk, and you said that African men. However, this is an ailment that's most associated with men, not women. Just to clarify that, yes?
Yes. Women don't have prostate. So it's only male.
Okay. All right. Well, I wouldn't know. I'm not a doctor. I jettisoned that dream way long time ago. But Dr. Kuti, thank you very much. You've actually enlightened us plenty on this health risk. And in a summary, you've asked that we make sure that we do checkups, especially if we have a history of this in our family lines. And the older we get, the more we might need to take it seriously and go for checkups. We appreciate this. Thank you very much. We're looking forward to having you back on the show again, so you are always welcome.